Patient has came to the emergency department after experiencing sudden onset headache with brief loss of consciousness. CT scan of the brain reveals blood in the basal cistern from a ruptured intracranial aneurysm. The patient is hospitalized, and over the next several days, he develops worsening hyponatremia. What is the most likely cause of his hyponatremia? Now, CT scan of the brain revealing blood in the basal cistern from a ruptured intracranial aneurysm. This is telling us that this patient has suffered a subarachnoid hemorrhage. So, following the subarachnoid hemorrhage, he has hyponatremia. The most common cause of hyponatremia following subarachnoid hemorrhage is going to be SIADH, or the syndrome of inappropriate antidiuretic hormone release. So, with the subarachnoid hemorrhage, the hypothalamus can get damaged, and that can result in increase in production of ADH. So remember that ADH and oxytocin are both going to be produced in the hypothalamus. ADH is going to be produced in the supraoptic nucleus, whereas oxytocin is going to be produced in the paraventricular nucleus. And ADH is then going to be released in the posterior pituitary. And remember that ADH is going to be putting aquaporins on the apical side of the collecting tubule, and this is going to result in water flowing in to the principal cell. And so we're going to be reabsorbing water, and as a result, we're going to be diluting our body, resulting in hyponatremia. Now, a way you can remember that the supraoptic nucleus is producing ADH is going to be with the mnemonic SAD POX. The P is going to be for paraventricular, and the OX is going to be for oxytocin. If you go back to the question, the answer is going to be answer choice D, which is increased antidiuretic hormone secretion due to the damage to the hypothalamus from the subarachnoid hemorrhage. Answer choice A, defective central thirst regulation. This is incorrect. This can also cause hyponatremia, but this refers to primary polydipsia, in which patients are usually going to have schizophrenia or they're taking a psychiatric medication, and this is not going to be associated with subarachnoid hemorrhage. Impaired renal concentrating ability refers to diabetes insipidus. Remember, diabetes insipidus is going to be the opposite in clinical presentation to SIADH. So patients are going to have hypernatremia, not hyponatremia. Answer choice C, inadequate dietary sodium intake. This is also incorrect. This is a very rare cause of hyponatremia, and it can also happen in alcoholics.